right, team. So we are having a conversation today around concussions, and we have Bryan Anderson, our director of Active Tracks, which is the sports medicine arm at CORA, and we have Ashley Langford, who is our director of clinical excellence at CORA in the CORA Institute for Clinical Excellence. Of course, I'm Adam on the marketing team here at CORA. And so today we are talking about treating concussion patients and the impact on the clinician and the patient. And I think how we're going to get this conversation started is by talking about concussion prevalence. And I think in the next 5 to 10 minutes, we're going to have a really robust conversation that will help not only the clinical audience, but also the general audience understand a little bit more about concussions, the treatment, and the impact on the clinician and the person who sustained the concussion. So, Bryan, Ashley, take it away. What can you tell us about concussion prevalence?
It's actually crazy. So concussions had a pretty crazy journey, I'd say, in the last 10 or 15 years, where when I got out of school way back when in 2004, we didn't really, not that we didn't care about them, but we weren't worried about them like we were. And then we started to figure out how serious they were, and got really severe on them. And I think we're actually in a really cool point now where we understand where they are and how they affect specifically patients and athletes, but also how they affect life and what it looks like pre and post concussion. So when we look at prevalence, concussion's a very different type of injury in that it affects every single moment of a patient's day. If we look at a true orthopedic injury, you may not be able to walk, or you may not be able to lift or reach out in front of you. With a concussion, you may not be able to do those things, but you also can't do things like drive your car or sit and watch TV or balance your checkbook. If anybody still does that, I just aged myself. So again, it really reaches into everyday, every facet of everyday life.
So you're talking about like, if I were to say, like, how does it impact brain, vision, function? These things are very important to a person. Athlete, non-athlete, mom, dad, anybody in our general population can sustain a concussion, and it will impact pretty much every facet of their life.
Oh yeah, and not only hearing, vision, balance, coordination, but also things that people tend to not think about: decision making, moods, your reaction, again, your personality, and we see it often where post concussions patients will have almost somewhat of a different personality per se. Yes. They may react to things more harshly. They may not react to things that normally would stimulate or give them, some type of reaction. And I think those are the things that we're now learning, and the long-term potential for disability and for issues, not only a week, month, 6 months down the road, but if not properly cared for, years down the road. And we've seen some very specific examples of that, especially in professional football.
And so what happens, right? Tell me about how I come in. So I'm out playing with my kids. I fall down, I hit my head, I probably get a concussion. I come in for care. Tell me, like, how do people arrive to care with a concussion?
So the vast majority of
them, they have one.
Go ahead.
Most of them don't even know they've suffered a concussion. You mentioned something, Bryan, that stuck out to me, because when I think of the post-concussive patient, A, they likely don't know, and B, I think of them, they're usually living in a bubble, right? How much does it impact them? It impacts them in the sense that they've almost become depressive, and they, not living the life that they want to. You can tell they're withdrawn to some degree.
Okay, so I come in, I am playing with my kids, I fall, and I hurt what I think is like neck pain. You're saying I can come in and it might be neck pain, hell, but I might also have a concussion. Is that what you're kind of alluding to?
Absolutely. Yeah, I mean, I agree with Ashley. I mean, again, I think that's kind of the problem is reporting, and that's where a lot of the education is going towards, is recognizing signs and symptoms of concussion and getting treatment. The majority, I would say, we've gotten a fair grasp on things for athletics, because we have amazing athletic trainers on the sidelines in a lot of instances that are trained to kind of key on this, and there's a lot of education for coaches. I would say before and after that level, right? So our adolescent, middle school kids, and then our weekend warrior and our elderly are the ones that they kind of wander for a little bit. So you may fall, and really remember when we talk about concussion, everybody thinks about hitting your head. It's actually that whiplash motion of your head that gives you the concussion. It's actually the movement inside the brain, and if you get really specific, it's even down to the cells and the axons moving against each other and shearing against each other that give us these damages and these symptoms. So again, it doesn't take much. A fall from standing height is enough to give you these symptoms. So most people don't think that they have an issue until a little while down the road, and they're like, I feel slowed down, or I feel this, or I've had headaches for the last 3 weeks. So when we talk about a path, part of the education process is showing patients that path, right? So where do I go? If there is a formal path now, I would say most of them enter through urgent care, the emergency room department, or through their pediatrician if they're pediatric. So urgent care, I fell, I hit my head, whatever it is, and I don't know what to do. And obviously emergency room takes care of the really severe auto accidents and that type.
Okay, so that happens to me. One of these things, I go to urgent care and they're like, all right, Adam, head over to PT. I head over and Bryan and Ashley are there and they're like, all right, let's bring you through, I imagine, some kind of testing, this evaluation. And let's shift gears and talk now about the clinician's perspective here. So now put your shoes into becoming probably the physical therapist. Talk me through that part now. So now I'm the patient. I realize something happened, and I go to there. Okay, we've covered the ground. Let's spend 3 or 4 minutes now talking about, from the clinician, what they should know, what they should be looking for, how do they prepare themselves for the concussion patient, etc.
Yeah, Bryan, I'll start with this and pass it to you. I'd say that the average patient's going to come in with, let's say, a diagnosis or a script for neck pain or something separate. So the clinician has to be, I think, of 2 things. They have to have the knowledge to know what to ask, right, that would represent your post-concussive symptoms. And then really it's diving in deep on the evaluation. It's really getting to know your patient. If you don't take that time to really maybe even stray away from the bare bones basics of an evaluation for neck pain, you're going to miss it most of the time. So really kind of listening to your patient and letting them explain to you their life and how it's been impacted can open the door then to recognize and identify their post-concussive.
Yeah,
and the PT has to be trained specifically in this, or is this something that they have kind of coming out of school now?
I'm going to make the generalized statement and recognize I'm a lifelong learner. I think we should never leave being a student, but I do think that continuing education outside of even the doctorate level for PT or OT would be required.
Bryan,
absolutely, yeah. I mean, I think that I'm going to shift gears a little bit, and we're talking about PTs and OTs, but our athletic trainers honestly are probably some of our biggest experts in concussion, because again, it's something that they see acutely. So I mean, again, you're the first line of defense on the field of evaluating and determining, is it safe for them to return to play, and then what's that plan of care? Do they need to go to the emergency room? Do they need to go to the doctor? Do they need to go to so what you see is a lot more piqued interest, I will say, to further this education on concussions. In the clinic, I think absolutely more training is necessary than out of school. I'm sure there's pockets in schools that do a better job of adding concussion or mild traumatic brain injuries into their neuro segments and into that portion. But really it's a complex issue that it's really complex when you look at it from the outside, but as a clinician, it works similarly to every other injury, right? There's an evaluation, and I call it following the breadcrumbs, like you do in every other, right? So I wonder why this is happening. I wonder why, if you get a knee, you don't just look at the knee, right? Is their ankle moving well? Is their hip moving well? Are they having low back problem? Again, so that you can treat the whole patient, right? So for us, what we recommend when we look at our courses is some type of symptomology checklist. We pull ours from the SCAT-5 because we think it's robust enough to give us an idea of what they're feeling. And sometimes that's enough for a neck patient to be like, yeah, I feel slowed down. I have headaches. I feel dizzy. And you look at it and go, maybe there's some more here. Let me look into a cognitive exam. Let me look into balance. Let me look into vestibular. Let me look into, but if you're scared is the wrong term, but if you're scared to do that, then you're going to miss it. And you're going to have a patient that has neck pain that doesn't ever get better.
Okay, that was gonna be my next question. If I'm a clinician and somebody starts presenting with these other things, and I'm like, okay, this person has something else. There's something else going on here. Is that a moment of, oh crap, is that scary? Or is it like, okay, no, I know what to do here. I mean, how do you prepare yourself for that? Bryan, you teach a course, I think, in concussion.
Yeah.
How do you prepare other people for that moment when they're like, oh crap, you have something else going on?
Yeah, I mean, I think it depends on your level of education and your level of your training, right? If you look at it and go, oh my gosh, they have a concussion, I know how to treat that, then it's not a big deal. If you're not as in tune with it, you may be like, I don't really know what to do with this. So again, yes, I think it's in kind of oh crap moment, depending on who you are. Again, a new grad that may have never experienced it might be a little bit more shell shocked, right? But the whole point, like when we teach, the whole point of this is, yes, anybody can do this. If you're a clinician, you have that foundation of education of going through PT school, you've probably gotten some of it. With some specifics, you can treat this and honestly be one of the more effective treatments that they can have. And really, we talk about patient impact. Again, we went through before how this affects day-to-day lives. You haven't lived as a clinician until you see somebody come in and tell you something like, I played with my kid last night for a half hour and I didn't get dizzy.
All right, pause there then. Tell it, one of you guys must have a story about treating a patient and them being restored to some facet of their life that like was a game changer for them. Like they couldn't do it before, they can't do it now. One of you must have a story, but that you have to share.
Well, I mean, what comes to mind for me is individuals that are parents, and I think that goes back to why I referenced the bubble, is just from like retrospectively, you think of times where those parents are disconnected to the point where they're not, the other person is taking care of the child. They're not able to function in social environments. They're taking they're in bed in the middle of the day. It's to me, it has such an impact that I can think of those parents that just can't do the basics of what they need to. And you can then start to really put together and visualize why it becomes this kind of dark, depressive, like, particularly if you don't even know why it's happening. If you didn't, if you left the urgent care and you didn't get a clear, I mean, even being told you had a concussion, if there isn't follow-up on the explanation as to the symptoms and where it goes from there, that this will get better, therapy can help, it's not an area you want to be.
Yeah, and Adam, I have two specific stories if you've got time, and kind of at both ends. One of them was an athlete I had at a university, who was a 4.0 double major student, and coach came to me and asked if they had come to talk to me about anything going on, because within like one semester they were failing out of school, and they were really concerned about them. So we got them kind of cornered, and turns out that the athlete had been during play kicked in the head, and had concussion symptoms for 3 or 4 months, but was afraid to tell anybody about it. And again, that is a kind of the other end of patient impact, right? Of not getting treatment right, not getting the care that they need, had a very, very harmful effect on their future, their present, their, the other one, and it's, I live for those moments of, hey, I went for a walk last night. So we had I had a patient this fairly recently, was a parent, had a few kids, also ran a business, and would come in and tell me all the time, like, I can't not go to the store. I can't not do this. I can't not do payroll for my business. So we did a lot of counseling on what we call the 4Ps, which is plan, prioritize, pace, and place. So listen, if you have to do your payroll, you've got to plan that out, give yourself set time for it, and do all this stuff. And literally next visit, that patient came in and was like, I did payroll, made no mistakes. And, again, I live for those moments, and every time it was like another step up. Yeah, I went to my son's baseball game last night, and there was tons of people there, and I was okay, or I had to step away for a second, but I was able to finish the game. Those are the things that, I think we live for as clinicians. There's a reason why you became a PT, right? And I think those are the things we live for, right? Is being able to do those things or see those things or be a part of that story, right?
Adam, I can give a very specific example too, without going into too much detail, but I think this is one of the main reasons that as a clinician that you really got to pursue this training. Those patients that you identify that they are kind of locked in their world and can't do the things that they need to. And Bryan, I'm sure you can speak to this, but when you identify and you're the one explaining to them that they are suffering from post-concussion symptoms and it's something that you can help them with, they'll break down crying just when you've identified what's going on, let alone being able to tell them like, hey, we can help you. You can get better with this. It is like, to me, that's the reason you go into the profession.
Oh yeah. Yeah, no, again, that's the coolest part. And that's why, my concussion journey started with my mom. Had a pretty serious concussion. I lived really far away. And she was not getting the care she needed and had concussion symptoms for 6 months. And pardon me, but it pissed me off, right? I'm like, how is there nobody close to her that can offer her some type of care? And this is before all the cool virtual stuff we have now, where I could have jumped on a Teams call or on something and kind of walked her through stuff. But that's kind of where I started really digging into it and really, really, really putting stuff on paper about there's got to be a better way. So again, I for the patient, obviously there's huge rewards. But not only that, again, if it's taken care of properly, if we look at athletes, if you take care of a concussion properly, they'll get back to play sooner, safer. Their chances of having another concussion, go down dramatically, right? Their chance of long-term disability decrease dramatically. If you look at it from the clinician sideline and from the clinician side, you get to be an impact on that patient's life. Yes. And that's kind of the halo, right? The golden standard. Selfishly, you also get to become an expert in a thing that not a lot of people have the nerve to kind of to wade into. And there's no reason why you can't. You can do this. We're not asking you to do brain surgery, right? To pun. But again, you get to become that expert. And what I tell clinicians all the time is, you think if you do a really good job treating that doctor's or that team's concussions, they're going to see you as an expert in everything else as well.
All right, good points. Let's wrap up. Let's talk quickly. Let's divide these items up and say, let's talk quickly. If I'm a patient and I just listened to this, I listened to you guys have your conversation. What are the key things I should be looking for in case I'm not feeling well? I'm feeling, I guess, what you're classifying as concussion symptoms. What are the things I should look out for specifically? And then on the other side, for a PT, spend a minute. What should we be looking for as a PT, OT, AT on the concussion side from the clinician perspective? So starting with the patient, what should I be aware of that I can maybe do myself as due diligence to say, you know what, I actually think I have a concussion. Maybe I need to pursue care for that.
Well, any person that thinks they have a concussion has to have some type of mechanism of injury, a fall, an accident, a car accident. Again, that whip-like type injury. And then you have to have some type of deficit to follow, either headaches, blurred vision, hearing difficulty, balance difficulty. But the number one probably complaint is, hey, I just feel off or slowed down. We call them processing errors. Where the frustrating thing where you click on something on the computer and you see that little wheel spinning. That's literally what's going on inside there. And that's what people will tell you. Like, I see something or somebody asks me a question and I go,
yeah,
and then answer.
brain fog.
Yeah. So again, I just feel slowed down, or I feel like everything's moving faster around me than I am. If you have any of those, and by the way, one symptom is enough to evaluate or assess as a concussion, because that one symptom could be the only symptom that's transparent. So as a patient, if you have that mechanism, or if you're a parent and you observe that mechanism in your child and they answer one of those questions, yeah, I have more headaches, or I feel slowed down in school, or it's enough, get them evaluated.
All right, now from the clinician side, what can I do to be prepared for that patient? What can I do? What I say, should I pursue education? Should I pursue certain, whatever it might be, that will make me better prepared? Or tell me more about that from the clinical perspective.
To me, yes, you should have some foundational level. Whether you go as far into it as we take things with a certification. I mean, obviously, I recommend that be as much of an expert as you can on things. But there's all sorts of really cool resources. The CDC even has cool stuff out there about identifying concussion, that's fairly free. That'll give you a kind of an entry level, we'll say, jump into this field. That's going to be your best defense, and your best way to care for these patients. But it's interesting when we talk about the clinician, it's the same thing as almost talking about a parent, right? So ability to look out, from yourself and look at your patient and go, I noticed that. I may not know exactly what it is, but I'm wondering if you have a concussion, and probe.
Yeah, absolutely. That goes into that, like taking it that step further in the evaluation, right? So, A, you got to know what to look out for. What are the symptoms? And B, you got to take it that step further to make that connection. And then I pick up on the fact that they're not living the life that they were before.
All right.
And
Any final words? Bryan, Ashley, that was, I think, productive. I feel like you guys covered a lot, and we remain focused on kind of our topic at hand. We're talking about concussions. We're talking about the impact that a concussion can have on a patient's life. We talked about the impact that care can have on the patient's life. And we talked about the impact that training and treating concussions can have on the clinician's life. Any final words?
No.
Go out, learn everything you can, and I think we've got an amazing profession as outpatient clinicians to help people. And I want to just say that Bryan's right. If you know an ATC and you're interested, go talk to them, because they've got that firsthand experience.
And lots of cool stories. Yeah. And I mean, I'll just end with this. I mean, again, when we talk about concussion specifically, the in-clinic clinician, we'll separate that out, has one of the biggest impacts on concussion patients. And I think it gets overlooked, kind of the rehabilitation side of things, in an active recovery. So again, you have the potential to do a lot of really, really cool things for these patients and impact their lives.
All right. Well, that wraps it up. I would say rate, review, subscribe, and continue to follow along for more topics like this. Thanks, gentlemen. Talk soon.
Yes, thank you.
Thank you.